Hello, this is Dr. Whiting, and today I want to talk to you about several things that are of tremendous importance to you and people you care about. And today we're going to focus on what I call the drug overdose. I'm not talking about street drugs. I'm not talking about all of those other things you hear about. I'm talking about good old-fashioned prescription drugs. Today there are more prescription drugs that are being used on millions of people every year that are worse for your health than anything you could get on the street corner. Sounds shocking, but it's true. Let's take a look at some things. But before we do that, I want to talk just a brief minute about the state of medicine in America. Over the last 20 or 30 years, medicine as practiced in the United States has become ever more drug-driven. And there's a wide variety of political and economic reasons for this. But just keep in mind that it's almost impossible for you to go to the doctor for any reason and not end up with a prescription for a new drug, or a drug that hasn't been completely tested, or worse yet, a drug that has already been proven to be both ineffective and potentially dangerous. How can the medical industry do that, you say? Well, the medical industry today is overworked, often underpaid, and certainly doesn't have time to do the research. Medical doctors rely on drug salesmen to help them make decisions, and that is not in your best interest. Let's take a look at some of these things. Let's talk about arthritis. Now, funny enough, we're going to be talking about the management of a lot of what we call chronic degenerative diseases, for the most part. And you're going to see that the drugs they use in desperation to try to bring relief and comfort and compliance and management to people are oftentimes doing more damage than good. So let's start with arthritis. I think you may have heard about the Vioxx problem. Then there was one called Bextra. Both of them have been removed from the market by the Food and Drug Administration. That leaves one big daddy left, and that's called Celebrex. Celebrex is still being used. It's still available. Hundreds of thousands of prescriptions for Celebrex are being written every year, in spite of the fact that there's overwhelming evidence to show that it causes stomach bleeding, kidney problems, liver damage, and just 200 milligrams of Celebrex every day clinically doubles your risk of heart disease. 400 milligrams, which is often the standard dose, triples your risk. Now, there are alternatives to this. There are natural anti-inflammatories, one of which we developed right here at our research institute. There are natural nutrients to help rebuild cartilage, joint, and connective tissue so that your body doesn't continue to deteriorate over the weeks, months, and years to come. Those formulas that we have developed are available for you. They're called Inflamease, Joint Flow, and Joint Flow Lotion, which is a nice topical lotion that's a natural anti-inflammatory. And these nutrients, these supportive agents, help the body to heal itself. If you're interested in finding out about those things, you can contact our office by email at askthedoc, ASKTHEDOC, at healthyinformation.com. You can also call our offices toll-free at 1-888-454-8464. Let's move along to digestion. Do you know more people take prescription and over-the-counter medications for indigestion, heartburn, acid reflux, and a whole host of other digestive and upper and lower intestinal problems? And the majority of those do not solve the problem. They solve the problem at mealtime, but ultimately they create far more problems. Things like Prilosec, Nexium, and many others are neutralizing all of the acids in the body. And 99.9% of the time, if you've got indigestion, heartburn, feelings of fullness, bloating, acid reflux, you have too little acid in your system, not too much. And by destroying what little you have, you take away the problem, you take away the symptoms, but you do not solve the problem ultimately. And this constant neutralizing of stomach acid leads to protein loss, calcium deficiency, immune problems, osteoporosis and bone loss, and increases your risk of bone fracture by 40% or more. There are alternatives to that. There are natural digestive products available, one we developed right here at our institute. And these not only increase the acid of the stomach, but they balance the pH and making the body not only comfortable, allowing the stomach and the digestive system to work properly, but ensures calcium absorption and protein digestion. How about cholesterol? Do you know that the group of drugs treating cholesterol, called statins, are one of the very few groups of drugs in the whole range that FDA requires routine blood tests for? Do you know why? Because they're so dangerous that they can potentially permanently damage your liver. Statins are one of the most dangerous groups. Crestor, and I don't mean to just pick on that one, but Crestor is one of the most popular ones, sadly, causes the risk for liver damage statistically when you take Crestor and many other statins is 75 times higher. And once your liver is damaged by these, it is often permanent and for the rest of your life. Again, there are natural alternatives. You can contact our offices at askthedoc@healthyinformation.com or direct by toll-free telephone at 888-454-8464. And we'll be glad to send you a link for a free special report outlining natural ways to solve these problems. How about diabetes? Did you know that diabetes is it is the #1 epidemic chronic disease, not only in America, but in like 50 countries around the world. And this is due to an overprocessed diet. And the new medications coming out for the management of type 2 diabetes are horrific. Avandia increases heart attacks. Januvia, one of the newest one, greatly increases the risk for kidney failure. Avandia, one of the most popular drugs, increases heart failure 109%. It increases risk of heart attack 42%. So great, now your blood sugar is normal and you die of a heart attack. More is not necessarily better, and in the desperation of these drug companies to come up with these new drugs in an attempt to make millions of dollars and supposedly help us, they're doing far more to damage your health than anything else. There again are alternatives. Here at our institute, we specialize in hypoglycemia, PCOS, type 2 diabetes, and all the disorders of glucose metabolism. Just contact us. We have programs that have been working for hundreds of thousands of people for over 20 years. What about weight loss? Weight loss seems to be the national pastime or obsession. How about the new one that causes great bowel disturbances? Well, Ally causes bowel disturbances simply because it prevents fat metabolism. So now you've got all of those fats and lipids passing out through your stool. No wonder you evacuate at 140 miles an hour. That's just a physical discomfort. So let's say you learn to live with that. But when your body doesn't digest fats, it doesn't absorb fats, it misses a tremendous amount of nutrients. You become deficient in vitamin A, D, E, and K, and you have problems absorbing other nutrients in the absence of fat. Alternatives include the right kind of diet. Here at the Institute, the first thing we do with our overweight clients is we test them extensively to find out how their body processes food. Once we understand that, we can put them on a diet program that's right for them. So, when you think about weight loss and you talk to your physician who then talks to a dietitian, understand that dietitians are still clinging to the age-old philosophy that the only reason people get fat is because they eat too much. Well, I will tell you that only about 30% of the overweight people in the world are gluttons. Only about 30% are addicted to food. The majority of severely overweight people eat less than most people, but they're eating the wrong types of food for their body chemistry. If you contact us at the Institute, we will help you establish how your body metabolizes food and how to find the right diet and supplements and exercise program, and it's all a whole lot easier than you might think. These are just some of the examples of how medicine and its control by the big drug companies of the world are putting your health at risk every single day. Before you take a prescription, stop and ask. And if your physician can't give you or won't give you the answers, you can go online to the physician's desk reference and get that information for yourself. Again, you are welcome to call our research institute. We have special reports on all of these subjects and many others that will show you the natural alternatives that you can use. Contact us at healthyinformation.com or call us direct at 1-888-454-8464. This is Dr. Whiting, and there is better living through drugs. Thanks for listening.